was 7 years old, I cut myself. I was catching frogs and salamanders in a pond, and I cut my leg really deeply. I was really scared. I remember how terrified I was. I was crying. Blood was streaming down my leg, and I could actually see flesh in my leg, and it terrified me. And I didn't know what to think, but I was panicked, and I thought I would die. And maybe an hour later or so, I met a stranger in a white coat with gray hair, and he reassured me. My mom was panicking. He reassured my mother, and I was terrified he was going to hurt me. He told me it wouldn't hurt, and right in front of me, sutured my leg. And by the time he was done fixing my leg, I thought to myself, I want to do that. So that's the moment that I want to become a doctor, and I pursued that since I was 7 years old. And I never thought for a moment that I'd go into obstetrics and gynecology until I was a third-year medical student, and my first on-call overnight was at the hospital, and I was on obstetrics, gynecology and obstetrics, and there I was in the delivery room. And when I actually caught my first baby, I was just, I was terrified too, but under the supervision of an excellent intern, I caught my first baby, and before I put the baby in the bassinet, I knew I discovered my destiny. I enjoy my work, and I know that looking back over 25 years, that if I had to do everything over again, I would choose the exact same specialty. I feel very blessed to take care of women. Women sacrifice so much, taking care of us, sacrificing their bodies and their souls, becoming mothers and being wives, and sacrificing their bodies to grow human beings inside their bodies. So I feel very blessed for two things. One is that I get to take care of women, and the other is that God didn't make me a woman, so I don't actually have to do all the suffering that women go through. But I feel very honored to serve, and I believe that my heart is there, that I have compassion for the sacrifices that women go through. So I feel like I've chosen the exact job that I want to dedicate my life to. My practice philosophy is very simple. It's called the mother principle, which is to take care of my patients exactly the same way that I would want my mother or my wife taken care of. I think it's very simple, and I think it makes all medical decision making very easy. Sometimes patients need surgery, sometimes they don't need surgery. Sometimes patients want to have surgery, but they shouldn't have it. Other times they don't want to have it, and they should have it. And a lot of the practice of medicine should involve listening. It's like going to a restaurant in a lot of ways. So the special of the day could be a hamburger, but if you're a vegetarian, you really shouldn't be eating meat, right? You refuse to do that. So in the process of listening to patients, I can tailor the treatment for what they want, what they need. My career over the last 25 years has evolved into more of a surgical practice. I take care of patients for reconstructive issues. When I was younger, in my 20s and 30s and even my 40s, I delivered a lot of babies, and I understood, after delivering thousands of babies, understand very fully all the damage that can occur to a woman's body as a result of sacrifice that she undergoes. And the essence of womanhood is beauty. Beauty is love, and a woman embodies this idea fully in her willingness and ability to sacrifice herself for others. As a man, as a physician, I do my best to embody my love and my skills as a doctor and as a husband, as a father. But as my career has evolved, I have become more of a surgeon, a reconstructive surgeon, and a cosmetic surgeon, helping a woman get back to becoming a more beautiful person for herself. And a lot of the cosmetic surgeries that I do are because a woman wants to get back to where she was. So that's, after decades of surgical practice, that's kind of what my specialty is these days. Yeah, I'm blessed as a surgeon to hear a lot of stories every day from patients that are happy, and as a surgeon, I wouldn't be happy with my job unless my office was filled with gratified patients. I think that the first time that I did an emergency operation, I was just a resident, maybe 30 years old, and someone. I was on call all weekend at Crawford Long Hospital. I was just a second-year resident, and I just had lunch with my wife Ann and my son who's now 25, but he was just like 1 or 2 years old at the time, and I got called to the emergency room, and a woman was dying from was bleeding to death from a ruptured ectopic pregnancy, and I was the only doctor there, and it was quite impressive it was quite. I hate to say the word fun, but it was fun to be able to intervene, to have the surgical skill with the guidance of an attending surgeon to clamp off the bleeding blood vessels and to save her life. I think every operation should be taken care with the same amount of dedication and effort and skill. The body is the body's very resilient and very strong, and yet we're all fragile, and we need help of an excellent surgeon.